Hello sir, I'm Dr. Sehun Danda. Today we're going to experiment with a new concept. We have invited an expert on the subject to join us. Next to me is Dr. Nakati Ugur Hazal. He is a neurosurgeon. Today we will discuss herniated discs and non-surgical treatments for herniated discs. Sir, our discussion today is about lumbar and neck hernias. As you know, lumbar and neck hernias are quite common in society, as are back and neck pain. So, what's our purpose of this video? Do all of these patients require surgery? How can we help these patients lead a more fulfilling and social life using different treatment methods? We will obtain answers to these questions from our expert with a series of brief questions. Our first question is actually, sir, what is the prevalence of herniated discs? Does everyone have it? Well, what treatments do people normally think of when they have a herniated disc, or what are the main problems they present when they approach you? First of all, thank you, Mr. Sehun, for inviting me to your YouTube channel. Of course, we often see back and neck hernias in our society. Well, especially with an occurrence rate of 85% in the world, we come across back and neck hernias at a rate of 80% in Turkish society. Our patients usually mention the word neck in relation to neck hernias, but they come to us with serious arm pain. Even though the word back is mentioned in relating to back hernias, it usually causes more leg pain. Therefore, back hernias are of great importance to us. Well, when we look at society, it usually appears equally among males or females aged between 35 and 40. Well, we don't immediately decide on surgery for back and neck hernias. Not every case of back or neck hernia requires surgery. Well, firstly, we suggest medication and alternative methods. Our patients can resort to behavioral therapies, manual therapies, and eventually physical therapy. For our patients who do not benefit from this process, radiofrequency therapy and epidural injection treatments can be administered. Sir, now we talked about non-surgical methods for herniated discs, and I apply some of them in my clinic. Of course, it doesn't always provide a 100% solution. Some patients go for surgery if they need it. Over there. Well, there were two situations you specifically mentioned. One of them was epidural injection and the other one was radiofrequency treatments. Now, I'm a little unfamiliar with radiofrequency, and what I want the most from you in this video is to explain to me what radiofrequency is. Even as a doctor, I'm not very proficient at it. Let's say I'm proficient when it comes to physical therapy. I'm proficient when it comes to drug treatments. I'm proficient in many things. But, for instance, I'm not very proficient with the radiofrequency part. If you explain this to us briefly in a video, let us learn it both as a doctor and for those watching us. Yes, now radiofrequency therapy is currently a very reliable treatment method in modern medicine, and it's a very trustworthy treatment method, not only for waist and neck hernias, but also used in neurosurgery. Apart from orthopedics, it's like heel spurs used in intra-knee injections and so forth. In the treatment method we perform, we send radiofrequency waves to cervical and lumbar hernias. In conjunction with a radiofrequency device and with a probe, we conduct a targeted treatment of the hernia there. Here it only detects the hernia that has occurred without causing any damage to the nerve and provides a target to there. Reduce the hernia with a wave. These are reliable treatment methods. The process takes about 1 hour. Fluoroscopy or ultrasound are the methods that we perform with the process. After the procedure, the patient can be discharged after 1 hour. Sir, there is another question I would like to ask you here. Many patients, in fact, try to avoid surgery because the reason is that patients are afraid of surgery. Why they are afraid? Mostly it's due to the side effects that will occur after the surgery, the sequelae, or perhaps my walking will deteriorate. Did my neighbor not benefit from his surgery? Or what do I know? Will I be paralyzed? They usually come to you with dozens of questions like this in their routine work. Now, what I am most curious about in this radiofrequency is this issue. We have done this treatment. Well, its effect is a different matter. But there also are side effects. I mean, do those question marks arise in patients' minds after the surgery? Or what kind of side effects may occur after the treatment? So you asked a good question. So we need to start with this. When do we operate on a herniated disc? Yes, if a patient has lost strength in his foot, if he has conditions like urinary incontinence, fecal incontinence, or bouncing while walking, if he has not benefited from drug treatment, alternative